You shower, brush your teeth, and think you're clean, but what if the most dangerous parts of your body are the ones you've been ignoring for years? After 70, your hygiene routine needs to change. Areas you used to overlook can now become breeding grounds for bacteria, leading to infections, painful skin conditions, and even immune issues. In this video, we're exposing 3 body parts most people neglect, one of which might be quietly draining your energy every single day. Stick around, because what you learn here could completely change how you care for yourself, and how good you feel every day. Feet, the first line of decline. They carry you through life, every step, every errand, every quiet moment in the kitchen. Yet for many people, especially after age 70, the feet become the most neglected part of the body, until they start sending warnings you can't ignore. And by then, it's often too late. What makes the feet so critical isn't just that they move you. It's that they're one of the first places where serious health issues quietly begin. Circulation slows with age. Nerve sensitivity fades. The skin becomes thinner, drier, more fragile. That means something as small as a cracked heel or a tiny blister can spiral into an infection, one that doesn't just hurt but can seriously threaten your independence. Here's the problem. Most people still treat their feet like they did in their 30s. A quick rinse in the shower. Maybe a towel dry if they remember. But the feet after 70, they need more than that. They need intention, inspection, and daily care. Because the consequences of ignoring them, they're more dangerous than you think. Let's talk about George, a 75-year-old retired shop teacher. He spent his career on his feet, teaching woodworking, building furniture, chasing after grandkids. After retirement, he stayed active. Walked the dog every morning. Gardened. Enjoyed life. But over time, his heels started to dry out. The skin cracked a little. He noticed some redness between his toes. It itched now and then, but he figured it was nothing serious, just age. He was wrong. Within a few weeks, the dry skin on his heel had split deeper. That crack became a sore. And that sore turned into a painful ulcer that refused to heal. A bacterial infection had taken hold. The redness spread. His doctor prescribed antibiotics, custom orthotics, and told him that if the infection didn't improve, amputation was on the table. That's how quickly it can happen. Now let's break down why. As we age, circulation to the feet decreases. That means less oxygen, fewer healing nutrients, and a slower response to even minor wounds. If you scrape your knee at 20, you might barely notice. At 75, that same wound could take weeks to heal, and in that time, it's vulnerable to every kind of infection. The skin also loses its natural oils, making it dry and prone to cracking. Those cracks, they're open doors for bacteria and fungi. Add to that the weakening of your immune system, and you've got a perfect storm. If you're dealing with diabetes, neuropathy, or vascular disease, the risks multiply. Diabetic neuropathy can numb the feet, so you may not even feel a cut or blister. By the time you notice, it's already infected. And poor circulation slows the healing even further. Even without chronic conditions, neglect can still lead to issues like athlete's foot, fungal toenails, and calluses that grow into painful pressure points. Most people assume these are just annoying cosmetic problems. But they can lead to cellulitis, a serious bacterial infection that can spread quickly and sometimes require hospitalization. So what can you do? You don't need a medical degree. Just a daily routine. One that takes less than 10 minutes and can literally protect your mobility and independence. Here's how to start. 1. Inspect your feet daily. Before bed or right after you wake up, take a moment to look at your feet. Use a mirror if you can't see them easily. Look between your toes, around your heels, and under your soles. Notice any redness, swelling, dry spots, cuts, or discoloration. What you catch early, you can treat early. 2. Wash thoroughly, not just rinse. Warm, not hot, water and a mild, unscented soap are best. Don't just let water run over your feet. Gently wash with your hands or a soft cloth, between the toes, under the nails, around the soles. Fragranced or harsh soaps can make dry skin worse, so keep it simple. 3. Dry completely. This step is critical. Leftover moisture, especially between the toes, is the breeding ground for fungus. Use a clean towel to gently pat every area dry. If bending is hard, a long-handled towel or a hairdryer on the cool setting can help. 4. Moisturize wisely. Dry skin cracks easily. Apply a gentle, fragrance-free moisturizer to the tops and soles of your feet, but never between the toes, where extra moisture can cause fungal issues. Look for products with ingredients like urea or glycerin. They help hold moisture in without making the skin greasy or sticky. 5. Choose the right footwear. Shoes should support, not squeeze, your feet. Avoid tight or worn-out shoes that cause friction or pressure. If possible, rotate shoes daily and choose socks made of breathable fabrics like cotton or bamboo. Wet, sweaty socks? Change them immediately. That trapped moisture? Fungus loves it. 6. Trim toenails safely. Cut toenails straight across to avoid ingrown nails, and never trim too close to the skin. If you struggle to reach your feet or notice thickened or discolored nails, a podiatrist can help, and it's worth it. This isn't just about feeling comfortable. It's about staying mobile, independent, and healthy. When your feet hurt, you move less. When you move less, your health declines. It's a domino effect. But the good news? You can stop that domino from falling. By giving your feet the attention they deserve, you're doing more than avoiding pain. You're actively protecting your freedom, your energy, and your quality of life. And here's the best part. Tomorrow morning, before you slip on your shoes, you'll know exactly what to do. One small habit. One big impact. But this is just the beginning, because the next area we're about to cover? It's even more overlooked, and even more dangerous if you ignore it. Groin. The silent danger zone. It's the part of your body nobody wants to talk about. Not at the dinner table. Not at the doctor's office. And certainly not in casual conversation. But that silence. It's the reason so many people over 70 suffer needlessly from discomfort, irritation, and even dangerous infections, right where they least expect it. The groin area isn't just private, it's one of the most vulnerable regions of the body. Warm, moist, and full of skin folds, it creates the perfect storm for bacteria, yeast, and fungi to thrive. Add age-related changes like reduced mobility, sagging skin, and thinner tissue, and you've got a hotspot for problems most people never see coming, until it's too late. Let's talk about why this happens. As we age, skin in the groin becomes thinner and more delicate. It also starts to fold in ways it didn't before. Gravity, muscle loss, and reduced skin elasticity mean deeper creases, perfect traps for sweat, bacteria, and moisture. If you're dealing with incontinence, even just occasionally, that adds another layer of exposure. Add tight clothing, synthetic underwear, or sitting for long periods, and you've got a recipe for hidden infections. Now, imagine trying to clean all that properly when it's already tough to bend, twist, or see every inch of your body. Most people don't give this area much thought. A quick wash, a towel swipe, and done. But that's not enough anymore. Take Margaret, for example. An 82-year-old widow who prided herself on staying sharp and independent. She bathed daily, kept her routines. But one thing she started to notice, and ignored, was a faint odor from her groin area. She chalked it up to aging. Everyone smells a little different when they're older, she told herself. But then came the itching. Then burning. By the time she sought help, what started as mild irritation had become a yeast infection spreading through her skin folds. It took weeks of prescription creams, barrier ointments, and careful management to clear it up. Her words after. I felt like I had lost control over my own body. And it all started with something I didn't even think needed attention. So what exactly is going on down there? Let's break it down. One of the most common conditions in older adults is intertrigo, a fancy name for a red, raw rash caused by skin rubbing against skin in moist, enclosed areas. It starts out as redness, maybe a little soreness. But with heat and trapped sweat, it can turn into broken skin, open wounds, and infections that require medication. Then there's jock itch. Yes, it happens after 70, too. Caused by fungal overgrowth, like tinea cruris, it leads to persistent itching, redness, and a rash that spreads. Left untreated, it doesn't just cause discomfort, it makes it hard to walk, sit, or even sleep. Another quiet culprit? Yeast infections. Especially common in those with diabetes or compromised immunity, Yeast loves the warm, damp crevices of the groin. It doesn't always show up with dramatic symptoms. Sometimes it's just a little moisture, a musty odor, maybe some slight scaling. But when it flares up, it can be downright painful. So how do you stay ahead of all this? It starts with something simple, a gentle, consistent hygiene routine. 1. Clean daily, even if you're not showering. Whether you bathe or not, make it a habit to gently wash the groin every day. Use warm, not hot, water and a fragrance-free, non-irritating soap. Harsh soaps can disrupt your skin's natural barrier, leaving it even more vulnerable. Use your hands or a soft cloth. Never scrub. Just a gentle cleanse in every crease and fold. 2. Dry with care. Don't just towel off quickly. This is the most critical step. Pat, don't rub, each area completely dry. Focus on the inner thighs, under the folds, and anywhere skin touches skin. If reaching is difficult, sit on a shower chair or use a hand mirror. A hairdryer on a cool, low setting can help dry hard-to-reach spots without friction. 3. Manage moisture. If you tend to sweat or experience leakage, apply a zinc-based barrier cream or a cornstarch-based powder, never talc. These create a protective layer that keeps moisture away from your skin while preventing friction. Avoid anything with heavy fragrances or chemicals, which can cause burns or rashes. 4. Choose breathable clothing. Tight underwear made of synthetic fabric? That's one of the worst things you can wear in your 70s and beyond. Instead, go for loose-fitting, moisture-wicking underwear made from cotton or high-quality synthetic blends designed to breathe. Change them daily, or more often if needed. Same goes for pads or incontinence products. Clean, dry, and changed frequently. 5. Monitor the area every day. Just like your feet, take 30 seconds a day to check for redness, odor, itching, or sores. Use a mirror or ask for help. Don't feel embarrassed. Health professionals see this every day and can help you resolve issues quickly. Why does this matter so much? Because the groin affects everything from how you move, to how you sleep, to how confident you feel in your own skin. It's not just a private part. It's a critical health zone that deserves your full attention. Discomfort in the groin can limit your ability to walk, socialize, or even sit through dinner without fidgeting. On the other hand, keeping this area clean, dry, and cared for leads to better mobility, energy, and emotional well-being. It's easy to skip. It's awkward to discuss. But it's powerful to take control of. Because when you care for the parts of you that no one sees, you're not just protecting your health, you're reclaiming your comfort, your dignity, and your independence. And believe it or not, the next body part we're going to talk about is even more forgotten than this one. Navel, the forgotten pocket of infection. It's tiny. It's hidden. And most of the time, you probably forget it's even there. But the navel, your belly button, isn't just a harmless scar left over from birth. After age 70, it quietly becomes one of the most overlooked danger zones on your body. You might be thinking, really? My belly button? Yes. And here's why it matters more than you think. The navel is a warm, moist, recessed area, basically a tiny cave tucked right into your midsection. It collects sweat, dead skin cells, clothing lint, and even soap residue. And unlike other body parts that get rinsed, dried, or aired out regularly, the belly button is often forgotten during daily hygiene routines. What happens when you ignore it? That small, innocent pocket becomes a breeding ground for bacteria and yeast, especially in seniors. Infections can form quietly and worsen over time, often without dramatic symptoms until the discomfort becomes impossible to ignore. Let's walk through the reality. As you age, your skin changes. It becomes thinner, less elastic, and more prone to trapping moisture. Your abdominal muscles may weaken, making your belly button appear deeper than it was in your younger years. That depth. It means it holds on to things longer: moisture, debris, bacteria. Now pair that with reduced mobility. For many people over 70, bending over, twisting, or even seeing the navel area becomes difficult. So what happens? It gets skipped, over and over again, day after day, until it turns into a problem. Let's talk about Peter. He was 79, lived alone, and had always been known for his cleanliness. Crisp shirts, neat haircut, polished shoes. He took pride in his appearance. But he began to feel a strange itch near his belly button. A faint musty odor followed. Still, it didn't seem serious. Until it started to sting and leak. Peter finally saw his doctor, who diagnosed him with a yeast infection deep inside his belly button. It had developed slowly, thanks to a buildup of sweat, skin cells, and debris. A simple area he hadn't even thought to clean had quietly become a health issue requiring weeks of treatment. His words. I never imagined the smallest part of me could cause so much trouble. And Peter isn't alone. In seniors, untreated naval infections can lead to a condition called omphalitis, inflammation of the belly button that can include redness, pain, discharge, and in more serious cases, even spreading bacterial infections. So, what are the early warning signs? A musty or sour smell. Mild redness or irritation around the navel. Sticky or moist feeling inside the belly button. Itching or soreness that doesn't go away. Discharge, yellowish, white, or clear fluid. Most people dismiss these as minor skin irritations. But ignoring these signs can allow bacteria or yeast to grow unchecked, and in older adults, slower healing and weaker immune systems only make it worse. The good news. Prevention is simple. You don't need medication. Just intentional care. Daily naval care routine. Clean gently. During your bath or sponge wash, take a moment to gently clean your belly button. Use a soft washcloth, cotton swab, or your fingertip with warm water and mild, fragrance-free soap. No scrubbing. No harsh chemicals. Just a gentle, circular motion to remove buildup. If you have an innie, be sure to reach into the folds. If your belly button is especially deep, clean it more thoroughly twice a day, especially in hot or humid conditions. Rinse and dry completely. Once cleaned, rinse the area using a clean damp cloth to remove any soap residue. Soap left behind can dry out the skin or cause irritation. Then, dry completely. That part is critical. Use a soft towel or cotton pad to gently pat the area dry. If needed, use a hairdryer on a cool setting to reach deeper areas without causing friction. Monitor for changes. Check the area regularly for signs of redness, soreness, swelling, or any kind of discharge. If anything smells off or looks irritated for more than a couple of days, talk to a healthcare provider. Catching it early makes all the difference. Adjust for lifestyle factors. If you sit for long periods, wear tight clothing, or are prone to sweating, take extra care to keep the area dry and clean. If you're overweight or have loose skin, your navel may trap more moisture than you realize, so a bit of extra attention goes a long way. If you've had past piercings or abdominal surgeries, those old scars can trap bacteria, too. What these body parts reveal about your health. By now, you've seen just how important it is to care for your feet, groin, and navel. 3 spots most people ignore without realizing the serious risks involved. But here's the deeper truth. These body parts aren't just hygiene concerns. They're early warning systems. When something's off in these areas, when there's an itch that won't go away, a crack that won't heal, a smell that lingers, it's often your body trying to tell you something bigger. So what exactly are your undercared body parts saying? Let's start from the ground up. If you found this helpful, don't forget to subscribe for more practical tips that keep you healthy, confident, and independent at any age. Hit the like button, share this video with someone who needs it, and drop a comment below with the one habit you're going to start today. Your journey to better health starts with small steps, and it starts now.